Hi, I'm April Benavente. I'm a student midwife from CSPC. At nandito ako ngayon sa seminar na ito para ituro sa inyo ang mga basic na dapat nyo malaman about the pregnancy-induced hypertension or kumbaga, yung mga pinaka-necessary nyong malaman about the topic. First thing is, aalamin muna natin kung ano nga ba ang hypertension or mas kilala bilang high blood pressure. At bakit nga ba ito delikado para sa inyong pagbubuntis at malaman rin natin ninyo ang mga pwedeng gawin in order to prevent it at hindi kayo mapahamak, pati na rin ang baby sa mga sinapupunan nyo. Blood pressure is the force of blood pushing against the blood vessel walls. The heart pumps blood into the arteries or the blood vessels that carry the blood throughout the body. While high blood pressure, also referred to as the HBP or hypertension, is when your blood pressure, the force of blood flowing through your blood vessels, is consistently high. In simple terms, when the heart is pumping out our blood, the fluctuating pressure is the blood pressure itself. When you are pregnant, hypertension is very risky and can lead to some complications and results to a worst event you can't imagine. So, hypertension can be a real deal and everyone should cooperate. Pregnancy-induced hypertension or PIH is a high blood pressure in pregnancy, wherein it occurs to 7 to 10% of all pregnancies. The PIH is also called the toxemia or preeclampsia. Kumbaga, it occurs mostly sa mga maagang nabubuntis and sa mga babaeng first time to be pregnant. More common din siya sa mga twin pregnancies. But before we continue to that, can anyone tell me kung ano nga po ulit ang hypertension, also called as the high blood pressure? Usually, there are three primary characteristics of this condition. First is high blood pressure, or a blood pressure reading that is higher than 140/90 millimeters in mercury, or a significant increase in one or both pressures, wherein the normal blood pressure is 120/80. Next is protein in the urine, and lastly, edema or the swelling. What causes pregnancy-induced hypertension or the PIH? The cause of PIH is unknown, but some conditions may increase the risk of developing PIH. For example, is kapag may pre-existing hypertension na yung mga nagbubuntis. Second is kapag may history na kayo or yung iba ng kidney disease or worse kapag currently meron siya nito. Third is diabetes, wherein alam naman nating lahat that diabetes really contributes a lot in terms of the hypertension. Next is PIH with a previous pregnancy, then mother's age younger than 20 or older than 40. And lastly, the multiple fetuses. So bakit nga ba ang pregnancy-induced hypertension is a concern? With high blood pressure, there is an increase in the resistance of blood vessels. This may hinder blood flow in many different organ systems in the expectant mother, including the liver, kidneys, brain, uterus, and placenta. There are other problems that may develop as a result of PIH. For example, is the placental abruption or yung premature detachment ng placenta sa uterus that may occur in some pregnancies. PIH can also lead to fetal problems including intrauterine growth restriction or the poor fetal growth ng baby and stillbirth. Kapag napabayaan, severe PIH may cause dangerous seizures and even death in the mother and fetus. Because of these risks, it may be necessary for the baby to be delivered early, before 37 weeks of gestation. So, there are preventions of pregnancy-induced hypertension. Gaya nga ng nabanggit ko kanina, early identification of women at risk for pregnancy-induced hypertension may help prevent some complications of the disease. Education about the warning symptoms is also important because early recognition may help women receive treatment and prevent worsening of the disease. So, mayroon naman mga treatment for pregnancy-induced hypertension, wherein specific treatment for pregnancy-induced hypertension will be determined by your physician or the doctor itself, based on your pregnancy or your overall health and medical history. Next is the extent of the disease, your tolerance for specific medications, procedures, or therapies. Ibig sabihin is dapat malaman din ng doktor if in some cases is allergic ka ba or hindi sa isang gamot. Next is expectations for the course of the disease. Lastly is your opinion or preference. So, mayroon tayong treatment in order to prevent the condition para hindi siya lumala at hindi na ito magdulot pa ng mga komplikasyon. First is bed rest, either at home or in the hospital, may be recommended. Second is the hospitalization, for the reason that kayo pong mga nanay is in need for medical personnels to help you and the hospital equipments itself. Third is delivery of the baby. Ito ay kung yung mga treatments cannot control the PAH or if the fetus or mother is in danger. In some cases, cesarean delivery may be recommended. Next is the magnesium sulfate or other anti-hypertensive medications for PAH. Lastly is the fetal monitoring or to check if the health of the fetus when the mother has PAH. So, that's a wrap. Wala na po kayong mga clarifications, questions? If wala na po, then our discussion ends today, and I would like to thank you all for participating, and I hope you learned a lot from me. Again, thank you po sa inyo.